I'm going to make you the host, Dr. Greene, now.
Okay.
Okay. So currently, you're the host. You can try and share the screen now.
All right. Let's see here. Click that. Okay, so I had to do something to allow the screen to record PowerPoint.
I've already recorded it. I'm already recording it. So you're good to go.
For some reason, it asked me to do that. So
okay, perfect.
Just give me 1 second.
Sure, sir.
All right, there's the presentation. Now, share screen. All participants. All right, so Microsoft PowerPoint. Oh man, this is
It'll come.
Zoom will not be able to record the contents of your screen until it is quit. I'll deal with that later.
Okay.
Okay, so am I should be sharing now.
Yes.
Okay, we see the PowerPoint, Dr. Greene.
You see the
yes.
PowerPoint? Okay.
Yes.
All right. And can
okay,
you hear
perfect.
Can you hear me okay?
Yes, I'm going to go ahead and do some introduction, and then
okay.
you can go over from there. So you're going to be the presenter. So
all right.
1 second. Okay. Hi, everyone. Thank you for joining in one more weekend wellness session. Today, like I said earlier, it's a registered event. We have the pleasure of having Dr. Greene here, Dr. David Greene. He is the founder of R3 Stem Cell. And currently, you know, like his first slide says, avoid surgery with stem cell recruitment therapy. That's what we're going to talk about today. And I also have the pleasure of having Suman Banerjee and Dr. Rumki Banerjee here with Apex MD. They are actually in partnership with Dr. David Greene for our Central Virginia location. And to give a little bit intro about Apex MD, give me 1 second. Apex MD is locally located off of Knuckles Road, and they have like walk-in schedules. They have like variety of procedures that can be done under one screen, and some of their specialties are like walk-ins available 6 days a week, and they have EKG, X-ray, ultrasound in-house, select labs, acute and chronic care are there, and they are basically a holistic approach. And like I said, Dr. Greene is going to go ahead and start presenting. Sorry for the early hiccups today. Dr. Greene, you can go ahead and start now. I'm going to mute myself.
Well, thank you for the introduction, and thanks for the opportunity to speak with everyone about stem cell and stem cell recruitment therapy. Today it's about 110 degrees here in Arizona, so I do not mind being inside at all, sharing some time with you guys. Dr. Banerjee has been a fantastic doctor to work with. They created Revive MD Center in Richmond, or Glen Allen, Richmond metro area, and we've been working with them for a while now. So I'll go ahead and get started. And one of the things that we're proud of is that so many patients have been able to avoid surgery with regenerative therapies. What I'd first like to do is I'll provide a background on where we are now with regenerative medicine. We use that term regenerative to refer to treatments that can actually help repair and regenerate tissues in our bodies that are damaged. And that's a very different approach than what the paradigm of medicine has been for the better part of the last century, where unfortunately most of the treatments that have persisted and come about are really just band-aids, for whatever we're all suffering from. I'm also going to clarify how the FDA looks at stem cell therapies in the United States, and I'll also explain stem cell recruitment therapy. So before we get going, I do want to mention our stem cell masterclass. We filmed this last year, and we filmed it for patients because there was so much misinformation online or wherever you go, that we basically brought together a lot of experts, a lot of patients, and we filmed 8 episodes, total of about 4 hours. And it's a really great resource to those who have questions, want to learn more. Anybody who comes in to see Dr. Banerjee, makes an appointment, gets the masterclass for free. You can watch it, share the link with your family and friends. So it was very exciting to put it together, and it came out great. There's like one episode just talks to about 13 patients about their story. One of them, we actually filmed a patient, a veteran. We filmed him before meeting with the doctor, the meeting with the doctor, the procedure, and then we talked to him a few months later, see how he was doing. So you get to see the whole patient journey. So if you go to stemcellmasterclass.org, you can see more about it. But to get the whole thing for complimentary, you just need to make an appointment with Dr. Banerjee. All right, so over the next 30, 40 minutes, I guarantee you'll learn a lot about stem cell therapy. You'll walk away with a very good understanding about the regenerative options. And at the end, we'll have a special offer from Revive as a thank you for spending time with us this afternoon. So one quick slide about R3 and Revive. R3 is a company that I started 8 years ago when I was in business school here at Arizona State. We have 40 centers now of excellence that we work with. Obviously, Revive is one of those. We surpassed 14,000 stem cell procedures last year. If you add in PRP, it's well over 50,000. We actually have 3 international centers right now. What we offer practices is first-rate biologics, over 15 different treatment protocols, very high safety standards, and help with patient education. For example, the stem cell masterclass. We years ago performed the first umbilical cord stem cell therapy in the Southwest United States. And last year we performed the first umbilical cord stem cell therapy in the whole country of Pakistan. Revive MD was founded by a very good looking couple. You may have heard of them, Dr. and Dr. Banerjee. They offer complete wellness services, including IV therapies, hormone replacement, all types of regenerative, whether it's for a certain condition, pain management, and aesthetics, stem cell facelift, stem cell hair restoration. Dr. Banerjee's done specialized training with us as well as others for that. They are an R3 Stem Cell Center of Excellence. They are in our network, and they've undergone the specialized regenerative training that we offer. We don't just do training online or, with lectures. The doctors have gone through that, but also participated in procedures and learned all the protocols on actual patients. At those trainings, we do procedures on veterans. We've treated over 100 veterans to date in our Heroes program. So Dr. Banerjee was able to work with several. All right, so let's dive right in. Surgery should always be the last resort unless it's absolutely necessary in an emergency, right? And let's look at arthritis. When you're dealing with arthritis of either the back or neck or a joint, it's not going to kill anybody. It's a quality of life killer. We know that. It can really affect your ability to participate in desired activities, but it's not going to be like the reason on somebody's, death certificate. But when you look at the traditional non-surgical options that we've had for so long for arthritis and tendonitis, they can help absolutely with pain relief, but they don't repair anything, right? They just, anti-inflammatories can mask pain, narcotics can mask pain. I used to hate it when I was in practice and, felt the need to prescribe a narcotic. People would say, well, I have a wedding this weekend. I really want to dance. And, there's nothing else is really working right now. It's a big flex. Now that I look back at it, it's kind of a cop-out because narcotics don't do anything as far as the actual disorder. And then you look at bracing, which can be great, but it's not, fixing any of the cartilage damage. And good old steroid injections. Steroid injections have been around since the 1950s. Very, very long history with them. And all these studies that have been done over the last few decades, pretty much the same. They show on average about 3 weeks of pain relief, which is a tragedy because not only do they not last very long, but there's several studies to date that have shown significant cartilage damage from those procedures. And, I used to do them 20, 30 times a day. For instance, when I was at the VA, I really wanted to help folks, and that was what we have had. So no longer is that the case. We're working with regenerative therapies now, which are not a Band-Aid. We'll talk about that in a moment. And they can help bring people back long-term to the desired activities that they've been missing. Really exciting to see people getting back to doing things they've been missing. And most of the time, it's extremely realistic things. I do about 20, 25 presentations a month when we're not dealing with the virus, obviously. And it's not too often that I hear somebody say they want to get back to running marathons, although it can, but most of the people in the audience are in their 60s, 70s, or playing for a professional sports team. Usually what I hear is, look, I just want to go hiking again. I just want to walk a little farther, go to the grocery store and do my activities around the house and not be in pain for the next 2 days. So we see those outcomes all the time. So why are regenerative therapies now mainstream? Well, they work great. We've been doing this for 8 years, 14,000 procedures, and year over year, when we ask patients a year out, would you have it done again? Would you recommend it to friends and family? At least 85% say absolutely. Also, it's been very safe. Safety is paramount. At all of our centers, we've never had a significant adverse event. Those are defined by the FDA as something that might put you in a hospital, a deep infection, or a disease transmission. We've never had any of those things. And, it's something I take a lot of pride in because we've never had any of those internationally either because of our quality standards. Now, you look back at steroids, we were talking about maybe a 3-week relief period. No, these procedures tend to last much, much longer. Typically a few years. Although when you're talking about, COPD, kidney, it's usually less than that because those are extremely metabolically active conditions that use up, a lot of resources in your body. We'll talk about the different ailments that these can work well with. And if you do the math, it's much less expensive than a major surgery. I'll give you one example. In this country right now, a total knee replacement averages around $60,000 cost to an insurance company. All right. Now, let's say you have straight Medicare, and that's an 80-20 plan, basically. And if you don't have a secondary, you'll be on the hook for 20%, which should be around $8,000 to $12,000. So these procedures are way less than that, and they work extremely well. So the way I look at it is we're reached a new normal where let's look at two sides of the cliff. On the left side of the cliff, you have all the things that we've had in the past and still have: bracing, cane, anti-inflammatories, steroid injections, all those anti-inflammatories. And then on the other side of the cliff, doctors will say, okay, we're trying all these things over here. Don't come back unless you want to talk about the other side of the cliff, which would be the joint replacement or, a spinal fusion or something like that. For so long, we just didn't have much to bridge that gap that actually helped with tissue repair and regeneration. And now we do. We have the regenerative therapies where so many people do so well that they don't have to go to the other side. Now, real quick, before I move to the next slide, I do want to mention that studies came out in the British Journal of Medicine less than 5 years ago. They looked at many thousands of knee replacements and hip replacements. And what they found is that 1 out of 3 individuals who has a joint replacement, a hip or a knee, are completely unhappy with that joint replacement after 1 year. So it's much higher than we ever thought. I used to think that 95% of people were ecstatic years after their joint replacement. Unfortunately, that's not the case. And the bridge has been burned, right? The whole joint's been removed and replaced with an artificial one. All right, so let's take a step back and talk about what exactly a stem cell is. So a stem cell is, I refer to it as a blank slate, because it's a primitive type of cell that has not made a decision yet of what type of cell it actually wants to turn into, a specialty cell. And you can see here that, well, here there's only 4 options: bone, cartilage, fat, muscle, but there's a lot actually. Hepatic for the liver, nerve, there's quite a few things it can turn into. Now, there's really only 2 decisions that a stem cell has to make in its life. One is, am I going to replicate myself? One stem cell can turn into 2 copies. Those 2 copies can turn into 2 more, so you get 4. And over time, it becomes an exponentially increased amount. The way that I refer to it is the Xerox copy phenomenon. When you first get a Xerox copier in your office, it's fantastic. The copies look just like the original. You can't tell the difference. But what happens over time is that the Xerox copier, the copies start to look a little bit degraded because the ink is going away. It's just not as, it gets a little pixelated, right? That's what can happen if a stem cell replicates more than about 8 to 10 times. Is it might look overall like a stem cell, but it's not functional. It becomes what's called senescent, and it doesn't do anything, okay? So we'll get back to that later as far as what that could mean. Now, the second decision a stem cell makes, and it's the last one, is basically, what am I going to become? And the interesting thing in our bodies is that the stem cell doesn't really make that decision. Your body tells it. It makes it for it. For instance, if you have a stem cell injection into your knee joint, you don't need a liver cell in your knee. That's not going to help you, right? So you don't need, a lung cell there. What you need is either cartilage or ligament or tendon, synovial tissue, whatever those tissues are pertinent. And that's the reason the decision gets made like that, is because your body tells it, look, here's where we are. Here's your options. Here's what we need. Now, become that. And that's what it does. And then it's done. It just becomes that specialty, worker bee cell for the rest of its existence. Now, before we go to the next slide, I wanted to point out that in the United States, clinically, predominantly we use what you see here. It's called mesenchymal stem cell. Some people say mesenchymal, but what we do not use, and those stem cells are great, okay? What we do not use are embryonic stem cells. So when you think about embryonic stem cells, that's what a lot of people think of as coming from, aborted babies, baby body parts. That is not in play at all. We've never used those. So where do these stem cells come from? Well, they come from consenting donors. After a scheduled C-section, okay, it's an FDA regulated process. There's no ethical issues about it. These are women that have been consented, very heavily screened with blood work and medical directors looking at their medical records. And it's a very regimented and regulated process, okay? All right, so I do want to bring this up. 25 years ago, this gentleman, Dr. Arnold Kaplan, who's at Case Western Reserve University, named mesenchymal stem cells. His research led to him naming them, all right? So he's responsible for that. Now, a few years ago, he decided, you know what? I think it's time to change the name. And the reason I bring this up is because we're going to talk about stem cell recruitment therapy in a bit. And the issue is, what are these cells actually doing if they're put into your body, okay? In this tissue, whether it's, and we'll talk about the different types of stem cell therapy here in 2 seconds, but if it comes from umbilical or amniotic tissue, nobody rejects it, all right? It doesn't cause a rejection response. So that's the first thing to understand. But regardless of whether it's your own stem cells from bone marrow or whatnot, or the amniotic or umbilical, we'll talk about those in a second. But what Dr. Kaplan's whole paper here, and I just put the title, talks about is mesenchymal stem cells, MSC. He wants to change the name to medicinal signaling cells, because a lot of what's happening in our bodies is that stem cells are actually signaling other cells in your body and also in the biologics that are put into your body, such as exosomes, cytokines, growth factors, secretomes, microRNA, to help facilitate repair and regeneration. So not only does it bring a lot of extra players to the ball game, so to speak, it also brings your own cellular processes and amps them up for the repair process. So just understand that it's not the stem cells who do all the work. They are signaling back and forth with your body and its own, the rest of the team it brings to do a lot of the repair and regeneration, okay? So just as an example, you don't need to, there's going to be a quiz on this. You have to memorize the whole slide here in the next 10 minutes. This is just actually a blown up part of a humongous slide that Dr. Kaplan's team put together of all the different signaling aspects that stem cells do. I just blew this one part up because there's a lot of signaling that regards with growth, trophic growth factors like growing new cartilage in your knee, for instance, preventing infection, antimicrobial, okay? Inflammatory, reducing inflammation. Inflammation is a big cause of disease and pain, and also modulating the immune system. So if you have rheumatoid arthritis, lupus, so on and so forth, it can really help with downregulating those processes that cause symptoms and problems, okay? All right, there's gonna be a quiz. Okay, so let's go through the regenerative options that are available in the United States currently, all right? I call it the regenerative umbrella, and basically it involves 4 different types of procedures. The first is PRP therapy, which is actually not a stem cell therapy. We're going to talk about that. Bone marrow, which involves tissue from yourself, the patient. Adipose, which refers to fat. Once again, that comes from you, the patient. And then umbilical and amniotic, which I typically call postnatal tissue. We'll talk a lot about that, okay? All right, PRP, let's touch on that. PRP is platelet-rich plasma. And basically all it starts with is some blood being drawn from you as a patient, a blood draw. You pick the arm just like, you know, if you were at the lab. And what's withdrawn is anywhere from 30 to 60 cc's, so enough to fill up 1 or 2 of these test tubes looking kits, okay? Now, so it's your blood, all right? Now that blood, that kit goes into a spinning machine called a centrifuge, and it spins it around for about 10 minutes, about 4,000 RPMs. When it comes out, what you see is what it looks like in this test tube here. It converts it into 3 layers, all right? The bottom layer is very dark and red. Those are red blood cells predominantly because they're heavy, so they sink to the bottom. We don't want those. Studies show that red blood cells themselves can actually be harmful to cartilage, so that gets thrown away. Now, the upper layer is mostly plasma, all right? And that contains some blood proteins, some nutrients, some hormones, things like that. We want that, all right? But the biggest thumbs up part is in the middle, and that's called the buffy coat. That's where a ton of platelets are and the good type of white blood cells. So basically the bottom parts gets thrown away, the middle and upper layer get used. That's the PRP. And, you know, platelets are great because they help with healing. There are about 12 different growth factors in these 2 layers. Growth factors are very helpful. They're like, I call them construction foremen, because construction foreman is an individual on the job site who's directing, okay, you go take care of that part of the building. You take care of this construction. So that's what they're doing, is they're basically facilitating repair in your joints, PRP. So PRP can be used in joints by itself. It can be used in soft tissue, like if you have tennis elbow or maybe a rotator cuff shoulder pain for tendonitis. A lot of our centers use it in conjunction with a stem cell therapy, because PRP is not a stem cell therapy. Nothing on here says stem cells. It is really not a stem cell therapy. There's very little stem cells in our blood at any one point in time. So if someone tries to, quote, sell you on a stem cell therapy that just involves taking your blood, that is fallacious. It's not a real stem cell therapy, okay? So as mentioned, when do we use it? It can be great for joints. It's not going to build up necessarily more cartilage or do things that stem cells can do, but it may be good for a few months of relief at preventing cartilage degradation. It can be really helpful for sports injuries or what we call overuse conditions, like I mentioned with tendonitis of the elbow or rotator cuff of the shoulder, plantar fasciitis, and heel pain, things like that. All right. But one of the biggest uses at our centers is when they do a stem cell therapy, they often add PRP to help upregulate the activity of all the cells. Okay. It's a very safe procedure overall. Now let's touch quickly on bone marrow. Bone marrow stem cell therapy, most people know of because it's use in cancer situations. All right. That is not what we're talking about here. In this bone marrow stem cell therapy, the bone marrow comes from you, right? It doesn't come from a donor, it's from you. In a procedure that involves a big fat needle that you see here, and that needle goes into your pelvic area, specifically your iliac crest, okay? So often it needs sedation, at least a ton of numbing, because it's very uncomfortable. All right. If you roll your fingers around your top part of your pelvis, it can be very sensitive. There's a lot of little nerve endings there. So studies show that between 35 and 50% of people end up with months of pain just from having this big fat needle put into your iliac crest. Okay. So, just imagine you go in to get a stem cell therapy for your knee. Your knee feels pretty good after about 6 months, but you come back saying, Dr. Banerjee, what did you do to my hip, right? So as a result of really that, for the most part, we don't have any centers offering bone marrow stem cell therapy anymore. But the second reason is that as we all get older, especially after the age of 50, we've lost over 85% of the amount of stem cells that we used to have in our bone marrow. So there's just not enough, so years ago, like upwards of 9-10 years ago, here's an example. You'd go into, let's say, Dr. Banerjee's office back then. He would take some bone marrow from you. Let's say your name's Mr. Smith. I'll say, okay, Mr. Smith, thanks for coming in. I'm going to take this bone marrow. I'm going to put it in incubator for 3 weeks, and then you'll come back and we'll expand and culture those amounts of stem cells so we have a lot to give you. So that was done for years. And then, like I said, 9-10 years ago, the FDA said, absolutely not. Nobody can do that anymore. So nowhere in this country can you get a stem cell therapy where anything is cultured or expanded, okay? So that plus the pain part, there's not enough stem cells and a high incidence of pain. We don't have anybody doing bone marrow stem cells. And if you're past the age of 50, it makes no sense. Now, if you're a 20-year-old athlete, 22-year-old, 25 in the major leagues or whatnot, yeah, there might be a reason to do it. Okay, let's touch on adipose. Adipose refers to fat. And once again, this is a procedure where the tissue comes from you. You're the donor of your own fat. And in this case, it comes from either the belly or the buttock area in a procedure that you see here called a mini liposuction. So every presentation I've done around the country, somebody asks, well, they get a big smile and they say, this is awesome. Can you take like 30 pounds out and do real liposuction while I get a stem cell therapy? The answer is no. Unfortunately, we haven't quite married those two procedures. So it's like 60 cc's of fat that's taken out. The good news is we have a lot of fat. I mean, a lot of stem cells in our fat, okay? And that's great. But what happens is, because of the FDA regulations, you're not allowed to stem cells will die within like 2 days of being put back into your body, okay? So as a result of that, we don't have many centers. Out of our 40-some centers, we have maybe 8 that do this, and they only do it in conjunction with what we're going to talk about now, which is the postnatal stem cell tissue. Some people refer to it as amniotic. Other people say umbilical cord tissue. Others say placental. I'm going to stick with the term postnatal, all right? Because in several of our products that our centers use, all of it is present. It's an ethical process. As I mentioned, it's FDA regulated. It's consenting donors after a scheduled C-section procedure. You know, normally the umbilical cord, the placenta, the amniotic fluid, it's discarded after a scheduled C-section. But in this case, it's not. The mother has been consented and screened, and it's a very regulated process. For instance, our main lab that we work with out of Utah, they'll have a technician, a certified technician in the room. And, you know, instead of discarding the postnatal tissue, it goes into a sterile container. It goes right back to the lab and gets processed right away. Okay. It takes about 6 hours for the processing. There's no radiation used. There's no, what do you call it? Animal, like one of the things a lot of labs will use is called fetal bovine serum. It's an agent that, you know, that you don't need to do that, and that can lead to problems with rejection issues and things. Our labs don't do any of that. Minimal preservative, just enough to keep it, the cells viable. So lots of cells survive, and it's a very potent, viable product at the end of the day, so to speak. How does it get stored? Well, it goes into a cryogenic freezer, very similar to how an egg donation process works. You know, you could take an egg donor, freeze the eggs, and then I've seen studies where they've used them 10 or 14 years later, and the eggs are fine. And this is no different. Freezing it does not kill the cells, it just suspends them. Okay, so these are some of the specialties where we've seen regenerative therapies being used at our centers. I'm not going to make any claims here, okay? But so I'll use the term anecdotal, okay? Because there has not been any large-scale clinical trial in the US. Has there been studies? Absolutely, thousands of them. But so I'll start with that disclaimer. Now, pain management is where things really got started in this country about 12, 15 years ago. And this is where I'd say over half of the procedures at our centers are performed for arthritis, whether it's degenerative, rheumatoid, psoriatic, lupus, tendonitis, bursitis. It just works so well for all of those types of ailments. Cosmetic, Dr. Banerjee at Revive MD offers the aesthetic procedures, and they are fantastic for hair restoration, facial rejuvenation. We call it a stem cell facelift, as well as PRP is used too. And the additional thing it can be great for is erectile dysfunction. You know, ED is a huge problem in men after the age of 60, 65, and these have a very good effectiveness, like 90% at helping with that issue. We've seen it used quite a bit in heart and lung, and studies along with our anecdotal results show that it can work really, really well at helping increase the ability of the heart to pump and the person's ability to breathe better, walk farther, sleep easier, things like that. On this side of the slide, neurology, it's fantastic for neuropathy. Anecdotally, our centers have treated over 1,000 patients with neuropathy. If you watch the masterclass, you'll see a few. One specifically is named Rexy. Rexy is a lady who got treated at one of our workshops. Her legs were they were not looking so great. They were pretty purplish, and she had a lot of numbness and instability with walking. And just as an example, she had the neuropathy protocol. And when she came back 3 months later, she didn't need her cane anymore, walking awesome, legs are nice and pink. And we see that very commonly. So when you listen to her story, she explains that and the time frame. Also for neurodegenerative issues, such as post-stroke, post-concussion syndrome, early stages of Alzheimer's, things like that. Anecdotally, we've seen fantastic results. So we talked about ED and urology. Endocrinology would be diabetes. There's some good studies on type 1 and type 2. Anecdotally, we've seen great results with stabilizing blood sugars and helping. These stem cell therapy is not going to cure anything. I just should say that. I should have mentioned that earlier. It can really help dramatically, but it's not a cure, okay? So anybody who tries to play that off on you, like, oh, get this one procedure, you're going to be set for life for your COPD or whatnot, that's not what is happening, okay? I'm not going to dive too much into the weeds, but what we're talking about, it could be major improvement for a long period of time, but it's not a one and done cure. So kidney failure, we've seen great results. And then rheumatology, whether it's, like I mentioned, rheumatoid, arthritis, psoriasis, lupus, it's been great. Fibromyalgia, even Lyme disease, we've seen really good results with. Lyme disease it really does kind of suck, excuse my French, because 20% of people with Lyme disease, they go through every type of treatment conventionally you can think of, and they fail. So what do you do then? Well, treatment with stem cells and exosomes, which are stem cell byproducts, can be fantastic. So one of the questions we get asked a lot is, how are these treatments performed, right? So there's an injection, IV, what happens? Well, there's different protocols. The most common is an injection. If you have a knee issue or a shoulder issue, Dr. Banerjee will perform that. But if you have problems all over, like a systemic issue, an IV is often the way to go. There are protocols for intranasal, which can be great, or a nebulizer. Studies show that the vast majority of stem cells survive when you nebulize them in. So that can be great for a lung issue. But let's talk about the IV, because when you give something IV, how does the biologic know where to go, right? Well, what happens is the doctor will do the IV, and the stem cells and all the exosomes and cytokines, growth factors, everything that's in that biologic will float through your body. Now, the good news is it's not random where the biologic ends up. The way it works is that any condition that we are dealing with, whether it's acute or chronic, is giving off inflammation, all right? Inflammation goes hand in hand with chronic disease. It doesn't matter whether if it's your kidney, your heart, what have you. Those areas of the body are giving off inflammation. That is what the biologic sees, okay? And it homes in on those areas that are dealing with inflammation, and that's how it knows where to deposit itself. Now, the really good news is that it doesn't all jump ship at the first sign of inflammation. So if you have a lung issue, some kidney issues, some of it will deposit in each area. Now, one of the reasons it's a great idea to take advantage of the free consultation with Dr. Banerjee is he's not a one-stop, a one-trick pony. He's a very knowledgeable individual with all types of holistic medicine, hormones, things like that. And it can be very, very helpful to understand what you're dealing with, because that will go into a lot of it of how much do I need? You know, the last thing you want is to have umpteen problems and then you settle on 1 cc of the biologic. It's just going to be, 1 cc has about 10 million stem cells in it. It's just not it can be helpful, but it's oftentimes not enough to deal with, a lot of issues going on. You may need 2 or 3. So that's how it works. Now, having said that, it's amazing. We'll have a patient get treated with stem cell therapy. Let's say it's for their lung issue. So they'll come back to Dr. Banerjee, let's say, and be like, "Oh, Dr. Banerjee, I can breathe so much easier. I'm sleeping better. I'm walking farther. But why is it that I can see better? Or why is it that my hair got thicker? All these other things." I call them collateral benefits. We see it all the time because you come in for one thing and the stem cells go to other places too and do a lot of signaling in those areas, and you get some benefits that you didn't expect. We see that all the time. Okay, so we touched on adipose and bone marrow, which are the tissue comes from you. And we'll delve a little bit more in just a second on the postnatal tissue, which has a ton of cytokines in it, over 70 to 80 growth factors, a lot of stem cells, and additional microRNA, things like that. But first, I want to talk about the FDA. So the FDA has been regulating these products for decades, okay? This isn't something that they started yesterday or last year. But as the popularity has increased with these biologics, they're sort of changing a little bit. Now, the good news to start with is before President Obama left office, he signed something called the Cures Act. Now, the Cures Act is a humongous piece of legislation with a chunk of it being dedicated towards regenerative therapies, okay? So it laid out a generalistic pathway for the FDA moving forward. So here's how they regulate biologics right now. So there's 2 categories. That's it for these biologics. And so that makes it a lot easier. One of the categories is acceptable in the United States, which is called minimal manipulation. That's what all of our centers use, minimal manipulation biologics. And then the one that's not acceptable in the United States called maximal manipulation, okay? What's the difference? Well, it's actually pretty straightforward. With minimal manipulation biologic procedures, they're acceptable in the United States. It's a same setting procedure. So for instance, we talked earlier about someone going in, getting some bone marrow removed, and then having to come back 3 weeks later. No, these are all done in the same setting. Nothing can be cultured in the United States, okay? What you have as far as in your bone marrow or your fat, or what comes out from the donation tissue from a scheduled C-section, it is what it is. You can't take that and expand it and make higher cell counts, okay? Also, the FDA is very touchy about what kind of enzymes or additives that can be used. They do not want any of the cellular structure to be altered. Okay, so they have a list, and on that list are certain enzymes and additives that can be used. If you go off script, you'll end up in this category. All right, maximum manipulation procedures are those that are not available here in the United States. They're available either in Mexico or Europe or Russia, Panama, places like that. The FDA says that if you do culturing, or if you add a bunch of enzymes that are not on their list, you're turning it into a drug, okay? Now, you can get those procedures with a passport in these various countries. There's a couple reasons why it's not necessary anymore. First of all, it can be very expensive. Anybody who's gone to Panama knows that it can cost $20,000 to $45,000. Same goes for Asia. And a lot of times you don't know what you're going to get. The FDA doesn't go outside the US. They're very strict here. So they have very strict regulatory standards, and our labs follow all of those. It's been very safe. They don't have that in these other countries. So it's not to say that it would be unsafe, but you just don't really know. you know? So now the third reason is you can't look at any studies from any of these countries and see that the results have been any better than what we're able to achieve under these regulations here in the United States. All right. No one's ever been able to show me a white paper, statistically significant outcome. It doesn't exist. So that's the main reason no one needs to leave the US. Now I made this up years ago. It's called the FDA 3-lane highway. I'm very proud of this. Hasn't quite gone viral yet, but I'm sure it will any day. Anyway, these are the 3 lanes of how the FDA regulates everything in the United States. The first lane are called devices. Anybody who's had a knee replacement or a surgical screw put in, those are devices that have been either approved or cleared by the FDA. It's not what we're talking about today, so we're going to switch lanes over to drugs. Drugs are regulated by the FDA through a clinical trial process. So think about all the drugs we have in our medicine cabinets. It could be I don't know, Prozac, Vicodin. Just think about it. Most of those drugs, probably all of them, unless they're an herbal supplement, have gone through a clinical trial at some point. 3 to 7 years, $30 to $80 million process for the pharmaceutical company. And once you get to the end of that road, it either gets approved or denied, right? So if it gets approved, that's when you start seeing it on TV a lot. Every night, 85 commercials on various drugs. And then eventually a lot of drugs start getting used for other things. 85% of drugs in this country get used for a lot of things that they were never actually approved for by the FDA. So decades ago, the FDA created this 3rd lane. I call it the biologics lane. Their official name for it is the human cellular tissue and tissue-based products, whatever, but it's the biologics lane, okay? It works a little differently, well, very differently, in that the FDA regulates labs. And I'll use an example of Utah Cord Bank, which is the lab we work with and have been for many years in Utah. They were FDA certified as a lab 16 years ago. Every year, the FDA comes back for inspections on a surprise basis, and they continue to be approved every year. All right. They've never had a warning letter. They've never had a recall. None of that. It's been a very safe, routine inspections that results that they've gotten. Now, that's how the FDA regulates these labs. The biologics that come out of those labs have a whole slew of regulations that they have to abide by, but they are not drugs. So they don't get FDA approved or denied. Okay. So people ask us that all the time. Are the stem cell biologics FDA approved? The answer is no, they're not approved or denied. They're very strictly regulated. Okay. That's the difference between a drug versus biologic, according to the FDA. I always like to point that out because it's one of the top 5 questions that we get. All right, so I'll go through quickly what's in the postnatal tissue. Now, it is incredible what we've learned about what's in these tissues. What these tissues do for the growth of the baby is absolutely remarkable. There's a lot of hyaluronic acid, which you may have heard of. It's very instrumental in our joints, as an example, for lubrication. It's instrumental in a lot of our skin and other tissues for collagen production. Now, there's over 80 different growth factors in the postnatal tissue. I put this picture in because they're like construction foremen, all right, helping other cells know what to do. Cytokines, which help modulate inflammation and autoimmune conditions. There's no steroid. You don't have to worry about the damage from steroid. There are a significant amount of stem cells in this tissue because at our labs, it's not radiated. There's not a lot of preservative used. Most labs, for instance, I live in Phoenix. There's about, 10 labs here, and about 9 of them use radiation. Okay, that's a disaster. Radiation kills almost all live cells. there's a lot of additional elements, microRNA, exosomes, secretomes. I refer to it as an orchestra. Now, I don't know a lot about an orchestra. I know there's a lot of people up on stage and there's a lot of different sections of an orchestra. So I just call them cell type sections, okay? If a lab uses radiation, a lot of the people on the stage are not going to be there. They're going to be dead. So you don't want that. You want it all, right? That's what you deserve, and that's what our centers offer. So let's talk about stem cell recruitment therapy. This is something that our centers offer. Revive offers that as well. And this has some insurance coverage. And we've shown in literature, this study backs it up, 92% patient satisfaction rating with these procedures, including, let's see, hold on, I'll come back to this. Coverage by a lot of insurance companies, TRICARE, Medicare, most of the commercial payers. There's a little bit of variation in various states, but it's an in-network coverage, okay? And typically, insurance companies allow multiple injections per year, either into the same joint or soft tissue or into other joints, okay? Let me go back. Okay, so who is a candidate? Well, anybody who's dealing with ailments of the hip, knee, shoulder, elbow, ankle, wrist pain from arthritis or sports injuries or overuse conditions, you know, that's what we're talking about. Also the spine, neck, or back pain. So it doesn't have to be arthritis. It could be tendonitis or bursitis, things like that will apply. So if you need an IV therapy or intranasal or things like that, this is not the program for you. Those are not part of stem cell recruitment therapy. They work really, really well, but Dr. Banerjee would work with you on financing or whatnot for those. All right, so let's talk about what is comprised in the stem cell recruitment therapy. These are amniotic fluid derived biologics. Amniotic fluid is incredible. When you look at what's in amniotic fluid, which is the substance in with, you know, as the baby is developing, it has a decent amount of stem cells. It's got a ton, billions of exosomes, which are stem cell byproducts that are really helpful in the regenerative process. There's a ton of growth factors and cytokines. So the milieu of amniotic fluid is amazing, okay? It's very, very safe. This particular product has been around for 9 years. There's never been a significant adverse event. So rest assured that it is a high quality, high safe product. And we talked earlier about MSCs being mesenchymal stem cells, and Dr. Kaplan wants to change the name to medicinal signaling cells. That is a lot of what's happening with these procedures. It's not only bringing an orchestra to the party, it's also recruiting your own body's stem cells to facilitate regeneration of new healthy tissue. So that needs to be understood, because with any of these procedures, what it brings to the party is not all that is going to bring the magic, all right? It's, yes, bring magic, but it's also going to recruit your own body's repair capabilities and harness those as well. So we talked about this. Now, Revive MD offers both stem cell and stem cell recruitment therapy. They will gladly perform a free consultation, either in person or even over the phone, to find out if you or a loved one is a candidate. Board certified doctors with specialty training in regenerative therapies. And some of you may be saying, well, why go to Revive as opposed to other centers? Well, here's what I can tell you is that I've worked with Dr. Banerjee. I've seen his technique. I've seen how he deals with patients. So first and foremost, you know, you won't be just a number in a, you know, a factory. It's not a Walmart type. Nothing against Walmart, but it's not that kind of a clinic. He will give you the time to understand what's going on with you, and it's not just a stem cell clinic. He's going to look at other things going on with you, because if you try and just like help everything stem cell procedure and you ignore the fact that somebody's hormones are totally out of whack, you really want a program. Okay, you don't just want a procedure. You want somebody to evaluate you as a whole person and figure out what's going to be the best program for you. What supplements after the procedure are going to be best for you to help your joint, make more cartilage and truly avoid the need for potentially risky surgery. Now, over the years, we have put together a lot of best practice protocols. There's currently 17 of them. So, we know, for example, a lot of things that other clinics just don't have a clue about. We know you're not supposed to put lidocaine in with the stem cell material. We know you're not supposed to mix, certain things together because it can be toxic to the cells. We know that you shouldn't get, the biologics from over 99% of labs in this country because they cut corners and they use radiation. Labs we work with, including the stem cell and the stem cell recruitment biologics, they don't cut any corners. To go 10, 12, 16 years without ever having a ding from either the American Association of Tissue Banks or the FDA says a lot. And when you look at the outcomes our patients have, over 85%, it's been incredible. So I wanted to put the contact information here for Dr. Banerjee's center. If you go to Dr. Banerjee's website, revivemdcenter.com, there's a lot of information, okay? The clinic is located, and the address is obviously on the website, in Glen Allen. They serve patients from as far as like 75 miles away. We've seen, just because of the quality of care and the outcomes. Here's a phone number, 800-REV-1247. It's obviously on the website as well. They accept most health insurance, and they also take care credit. They can work with you on that. So there's every reason to take advantage of Banerjee. Dr. Banerjee will look at you, evaluate you extensively, and figure out what are your issues, and lay your options out on the table. Stem cell therapy or stem cell recruitment therapy may not even be in the cards for you if you're not a candidate. You may not be a candidate to start with, but there's a lot of options at the clinic. Like I said, they offer a full program and not just a procedure. All right. I'd like to thank everybody for their time. I realize I went a little bit long. Sorry about that. Let me stop my sharing.
Okay.
Be happy to answer questions.
Yes. Dr. Greene, I'm still going to leave you as the host because you can answer all the questions and stuff. And if they can put the questions on the group here, that'll be easy for me to guide it to Dr. Greene. I can put you on a queue. So once again, thank you. Thank you so much for your time and a great presentation. And thanks to Revive MD for their time, Dr. Suman Banerjee and Dr. Rumki Banerjee. Thank you once again. So any questions now, you can ask Dr. Greene.
I have a question. Is this procedure is going to be like an IV? It takes a while, or it's like a injection? How does it get done?
Very good question. Can you hear me?
Yes.
Okay, great. I apologize. I don't know how to pronounce your name. Is it MASH?
MASH.
MASH.
Yes.
Okay. So just like it sounds.
Yeah.
So MASH, what'll happen is, there's 4 different options of how these procedures can be performed, and they're not mutually exclusive, right? Because if somebody has neuropathy, as an example, the best protocol is to do various injections into the legs as well as an IV. Okay.
Right.
If you come in with I call it a laundry list of ailments, like, okay, well, I've been dealing with diabetes, I have really bad arthritis in this knee, and this and this. To start with, an IV may be the best option for you. Dr. Banerjee would work through that with you. Now, if you have a lung issue, we found that the nebulizer option is great. quick, it's easy, it takes about 20 minutes, and you get the cells right into the lungs. The other one is intranasal. One of the very safe methods that we found for getting the biologic into the brain cavity is intranasal. It's very permeable behind the nose before the brain. So you can get a nice penetration as opposed to doing an intrathecal, which is where the injection will be into your spinal cord. That's, got some issues. So this is very safe and easy. But the bottom line is that it is going to be a customized solution depending on what you come in with. If you come in with just a knee issue, then most likely you're just going to get a knee injection because that puts the cells where they need to be anyway. Okay.
Right.
Before we go to the next question, someone has their TV on behind. Can you please mute it? Because we are not able to hear Dr. Greene or Nash, the questions, the interactions. Thank you so much for muting the TV. Dr. Greene, there is a next question from Anil. He's asking, what is the recovery time for a regenerative therapy?
Yes, that's a great question. I should have addressed that earlier. I apologize about that. So one of the beauties of these procedures is that there's not a, many months recovery, okay? Over the years, we've looked at centers that have a very strict and regimented process versus, okay, take it easy for a few days and then start to do things that, you can tolerate. And one of the, for instance, for what we'll call musculoskeletal, which would be hip, knee, joints and soft tissues, mostly what Dr. Banerjee will tell you, and I don't want to put words in his mouth, but typically, okay, for the next few weeks, stay away from high impact activities, meaning I don't want you to do hard jogging or go to the ski slopes, like Black Diamond ski slopes, right? Walking is fine. Exercise bike, things that are lower impact are absolutely fine to do. You can probably go back to work, the next day. There's not a big downtime for those. When you start talking about the IV therapies and things like that, it's the same as far as downtime. You can get up the next day. We want people walking and doing things like that. However, when it comes to when you're going to see results, most people within about 2 weeks see results for the joint injections, maybe a four week. At the most should be 6 weeks. If not, you may need a booster PRP or something. But when it comes to kidney, lung, things like that, it's probably going to be 2 to 3 months before you start really noticing a difference. The first thing that people tend to say at our centers is, my energy level is starting to go through the roof, okay? And then as time goes on, Dr. Banerjee will do some tests on patients to see how their lungs are doing or kidney or whatever the issue is, or blood sugars, but it usually starts to really get better after 3-4 months. So keep that in mind.
Thank you. The next question is from Lisa Baxter. Sasanka Joanna. Thank you for the session. Is there any data on how many people this therapy was done and what is the success rate? Just curious about the numbers.
Sure. So as I mentioned, at our centers, we're over 14,000. But when you look at actual studies in, say, PubMed or Google Scholar, they both have repositories of these studies around the world. They are really effective. For instance, the study that I showed, the 92%, there's a lot of patients, and they followed patients for, I wish they had gone out 1 to 2 years. They went out 6 months, but 92% was the average patients who had at least a 50% pain relief with knee injections with the same product that Dr. Banerjee uses for the stem cell recruitment program. So when you look at studies on, I'll just pick a few. Here's one for cardiac disease, cardiomyopathy. This was a study done out of Chile in 25 patients. What they noticed was a 30% or 15 to 30% increase in the ejection fraction of the heart. That's not easy to get, 15 to 30%. That can be the difference between doing well or needing a heart transplant, right? There have been studies on diabetes, which showed really nice regulation of blood sugars in patients either with type 1 or type 2 diabetes. Wasn't a cure, but it can help the ability of the pancreas to do its job. Yeah, I mean, if someone has a specific question about a specific condition, I'd be happy to send some of the papers. That we have a huge database of papers.
Okay, the next question is from Lisa. Lisa is asking, how does hair restoration or regrowth process work in a treatment program? Why do some labs use radiation? What is the purpose?
Yeah, I'll start with the second question. You know, radiation to me, if a lab uses it, is a cop-out, okay? Because it's a cost-cutting mechanism. If you use radiation, radiation kills the bad stuff, like any bacteria or whatnot. It also kills the good stuff, right? But that's just stupid. And labs will do that if they want to compete on price, as an example. So think about it. You know, you're a provider in Wichita, you start doing regenerative procedures, and you think that all these biologics are the same. So you start shopping based on price, and a lab that has used radiation has a, you know, crappy product with very, very minimal, if any, live cells. And, you know, they come out and say, you know what, I'll beat their price by $50 or $100. And the doctor says, oh yeah, let's do it. That's to your detriment, okay? Because patients don't know, a lot of doctors don't know. You'd be surprised. We have about 30 doctors a month coming to our trainings. And I'd say about half of them know the difference between a viable live product versus a radiated product. The FDA doesn't require radiation. They just require the biologic to be tested. So the way that we describe our biologics is that they are aseptic, meaning they don't have, they're clean of bacteria, they're clean of diseases. The ones from radiation are sterile. They don't have anything living in them because they've been radiated. So first part of your question, Lisa, was, oh yeah, the hair restoration. So, you know, when you go for a, what's it called, a hair transplant or something like that, you know, those are pretty pricey. They can, you know, people are like, oh, it's $4 a graft or whatnot. Well, you know, you're doing, you know, 5,000 grafts, so it's 20 grand at the end of the day. So initially, our centers and nationally, most people are just using PRP therapy for hair restoration. And that can work really well. You know, it takes some of your blood, spins it, and then does a hair restoration procedure in those areas that really need it. What we found, though, is that if you have the PRP and you add the stem cell biologic to it, or an exosome product, which is a stem cell byproduct, it can really bump up the results and have them last a much longer time. So as an example, we've had centers that used to do a PRP procedure every 3 months come back and say, you know what, ever since we added exosomes or the stem cell material, we're doing it like once a year. And the results have been fantastic when they look at, there's a little, almost like a, I don't think, it's not a microscope, but a magnifier on the iPhone device that shows how the follicles are doing. It's very dramatic in patients who are candidates, you know, for these procedures. The results that get seen, it's usually at around the 3-month time frame when it's very dramatic.
Okay, same on Lisa. There is another question. Before I go to the next question, do insurance companies consider this as an experimental treatment?
Well, yes and no. So when it comes to the IV procedures and, you know, a lot of the joint procedures, actually, they do consider it experimental. So for those, it's an out of, you know, patients pay for that, because as with a lot of new technology, the clinical utility has gotten ahead of insurance companies. For the stem cell recruitment therapy, though, those are covered by insurance. The products have a special code that they've gone through, and they've gone through Medicare coverage guidelines. So there are coverage for those. And they were not approved because of their stem cells. They were approved because of the other effects: cushioning, protection, lubrication, or hyaluronic acid biologics. That's the reason that Medicare covers them. It just so happens that they also have some of these other cellular components. So it's amazing what the results we've seen, and the fact that, there's insurance coverage by and large. There's some variations from state to state.
Okay, and then next question is from Barbara. Is this helpful if you have disc degeneration in the spine?
Yeah, it's also a very good question. So the answer is yes. The procedure. We've seen patients do fantastic either way. We've also seen patients do really well if you have simply injections in the paraspinal muscles. For example, we know that when you inject the biologic into the paraspinal muscles, it sits there for months and slowly leaches out into the bloodstream and the surrounding area of the spine. So it can give patients really, really good results. Now, we've also seen it where, for instance, at our training workshops, we've had power lifters and others come in, and the doctors have done injections right into the disc, intradiscal, and they've done fantastic as well. So the answer is yes, we've seen really, really good results, but it's a little bit not black and white as to how the stem cells are administered to get that fantastic result.
Next question is Ms. Mash. Does it help with the immune system and current pandemic?
So I'm not going to sit here and make any claims about that, okay? But what I will say is, for patients who have rheumatoid arthritis or immune system issues, autoimmune conditions, we've seen nothing but fantastic results with modulating the immune system and really helping. Because if you look at the current options for rheumatoid, for instance, like with methotrexate, methotrexate was a chemotherapy drug when it first came out. It's got a lot of toxicity with it. So when you talk about something that has, really minimal side effects, you might get lightheaded for 10 minutes or, it just doesn't. So when I saw the results from, let's say, the first ones that came out of Wuhan in China, where they looked at, I think it was 10 patients who had mesenchymal stem cell therapy for the virus, the ones who got it did really, really well. The 3 that didn't get it, they all died. So now you look at other results from other countries, and the biggest problem with the virus, and we haven't marketed for any of this because I don't want to exploit anything when it hasn't had track record of years and years. But when you look at the biggest problem with the virus, it's the cytokine storm. And that's oftentimes what leads to the lung failure, the ARDS, and things like that. These mesenchymal stem cell biologics have been really good at mitigating the cytokine storm. I really don't know why it's not being more widely utilized, especially when there's been so much harping on these drugs, FDA-approved drugs that were approved for other things. But, they tried, what was it? Not chloroquine, but the one before that. I mean, it was killing people. Side effects were causing organ failure. I mean, they just don't have these problems with stem cell therapy. So the short answer is, I think it should be used a lot more, but it's not a drug, it's a biologic. So, it's not as easy for the FDA to go down that pathway with it.
Okay, and I'm going to go with the last couple questions. I guess we are lengthening this a little bit. So the next question is, does this help patients with high blood pressure due to enlarged heart? And I'll also hit you with the following question. Maybe you can answer both in a it's 2 different questions though. What is the data available on people with EDS?
Yeah, okay.
Or in patient group with chronic Epstein-Barr virus? Okay, so I'm giving you a few questions together.
Actually, I'll put the other one in there too on pulmonary fibrosis.
Perfect, pulmonary fibrosis.
Right.
Yeah.
So for lung issues, we've seen great results, whether it's COPD or fibrosis. It's not going to resurrect scar. Our international medical director, we see a lot of people with kidney issues internationally. And look, if it doesn't have at least 20% function, then it's probably not going to work. It's not going to take scar tissue like fibrosis in the lung or the kidney and make it non-scar tissue. Okay, we're not there yet with the genetic engineering. When you look at something like EDS, which is a genetic, issue, one of the things that is amazing to see is that we don't have any evidence that the DNA from the stem cell material becomes part of your DNA. It doesn't engraft into your DNA. I'll give you an example. This lady in Portland, bless her heart, she asked Dr. Cohen, who owns the clinic there, she said, look, I'm going to get this injection into my knee. I'm African American. If the donor is Caucasian, is my knee going to turn white? That is a very legitimate question, right? It's a little funny to think, but the answer is no, because the DNA from the donor does not end up becoming part of your DNA. So what that means is with a situation like EDS, can it help? Absolutely. It's not going to cure the EDS though. It doesn't take the genetic issue and fix it. All right. But EDS can lead to a lot of problems. My sister-in-law has it, and I see what is going through. And then she's a member of, I think, one of the national organizations with EDS. So you hear some of their stories too. But when you look at people who have EDS or some of these other genetic conditions, it can help with a lot of the other issues that people are dealing with, but it's not going to fix the EDS permanently, right? It's not going to genetically cure that. And with Epstein-Barr virus, Epstein-Barr is a little bit of a tricky situation. I guess I would put it into the same-ish category as fibromyalgia. We've seen dramatic results in over 100 patients with fibromyalgia and Epstein-Barr. One of the things that Epstein-Barr and I think fibro is, the problem is it's just sucking your immune system. Your body's dealing with it, and you get so tired because your body's dealing with this immune system issue. But if you can modulate that with the regenerative biologic, then it frees up all this energy to have a better life again. So that's what we've seen repeatedly is with any of these immune issues, whether it's Sjogren's or rheumatoid or, fibro or whatnot, we've seen really good results because of that modulation of the immune system.
All right. Pretty much, I'm going to use this as the last question because it's a longer question, and it's from Mr. Ashok. I have chronic pain in my lower back, neck, left shoulder, and left knee. For my back, I have had 2 fusion surgeries already between S1 and L3. Now at L3, there is disc touching the spinal cord. At L2, there is disc protruding into spinal canal. So just for lower back pain, I'm scheduled for a surgery for fusion between T10 to L3, I guess. Yeah, T10 to L3 on June 29th. What is your initial advice? I also had 2 fusion surgeries at C3 and to C7 and right knee replacement. None of the 5 major surgeries have worked. You hear this all the time, right?
Yeah, that was a mouthful. But, I think the first thing I'll mention is that, I haven't practiced in years. So nothing I say should be used as strict medical advice, right? I try and, take results from our centers. I take the data that we have and that is in the literature. When you look at spinal issues, and looks like there's other issues too, shoulder and left knee, the problem with spinal fusion, I did a bunch of them when I was in practice, is that, you're never going to have as good of a result as the first procedure. And that goes the same for a knee replacement or whatever the index procedure usually gives the best results. The other ones, you're often looking at adjacent segment degeneration, or additional scoliosis or what have you. But a stem cell therapy can be very beneficial at reducing inflammation and pain and helping with some tissue regeneration, but it's not going to fix a mechanical problem. For instance, if you have, slippage of one vertebrae and another, it's not going to pull that back. If you have spinal stenosis where you have overgrowth of tissue in the canal, all the studies show that stem cell therapy can be very helpful, but it's not going to take that excess tissue away. Okay. So there's not a simple answer, but here's what I will say is that, we get these types of questions a lot, whether it's for something, like this with a spinal issue, or whether it's for like an exotic condition like trigeminal neuralgia or things like that. The bottom line is that these procedures are not going to hurt anybody. They're very, very safe. We've seen really, really good results. There is a chance that it wouldn't help substantially with something complicated like what that question just involved. So I think it's something to consider and have Dr. Banerjee's, evaluation for it, because I can tell you, I've done plenty of those T10 to L3 procedures, and spinal surgeries overall have about a 65% complication rate. Not to totally scare you, because they're not all major complications, but stuff happens, okay? But when you talk about these regenerative biologics, it's been so safe. It doesn't burn any bridges. There's no reason you still couldn't have the procedure if you didn't get the results that you wanted. I think it's worth looking into.
Okay. I'm going to stop with the questions right now.
Can I answer one more?
One more. You want to answer Anil's question?
Yeah, that's what I was looking
Which
at.
therapy will you recommend for a shoulder rotator cuff tendon tear?
Yeah, that's the question I was looking at, because
Okay.
I think it's a very good question. It's a very common question, and it's something that we have a lot of experience with. Okay, so if you have a rotator cuff tear that has a pretty large gap between the two ends, it is not going to be a miracle where it brings those two retracted ends back together, right? Most people don't have that, though. If you look at the literature, most people have a small tear or a partial thickness tear. This works great for those. And with the stem cell recruitment therapy program, now you have a great biologic that oftentimes gets coverage, under insurance. And it may be that you end up having 2 procedures a year that are covered. But when you talk about rotator cuff tendonitis, bursitis, micro tears, partial thickness tears, this is something that, because with surgery, it can work really well, but it's pretty long rehab. There could be issues with, literally half of rotator cuff tendon repair surgeries fail within a year.
Yeah. So, all right. I think I'm going to pass the thing to Suman, Dr. Suman Banerjee, to say some final closing statements. And then I have announcement about Weekend Wellness tomorrow's session. So Suman, you can take over, sir.
Okay. All right. Can you all hear me?
Yes, sir.
Okay. Well, thank you so much, Dr. Greene. I'm sure it was a very, very enlightening presentation for a lot of our audience that were able to make it in today. So thank you again. Appreciate that. And again, we are very excited to partner with R3. We are kind of following the guidelines that they have actually set and established over the years. We are not starting anything new in Richmond. We've actually been fortunate enough to find Dr. Greene and partner with R3 so that we can bring this service to a wide community, which is in and around Richmond. So the plan of action from here is I will be actually sending out to everybody a patient consumer guide, which will give you a lot more information about many more questions that you may think about tonight and tomorrow. But Dr. Greene's company, R3, has actually formulated this patient consumer guide with a lot of information to bring about the awareness about stem cell recruitment and the regenerative program. The process will be for anyone who's interested. We do offer the consultation. To get this done through insurance, there are a couple of steps that needs to be fulfilled, like looking for medical necessity and trying to get prior authorization and evaluation. And that will kind of put us in the right path. But however, besides the musculoskeletal stem cell recruitment program, the process can then be available also to a lot of other people, even if it is not covered through your insurance. So we do have a combination of both the programs. As you've learned today, there are multiple benefits of trying out these biologics, but it's not necessary that all of them will be covered through your insurance. And those are processes that we can discuss in detail when you have our consult with us. And both my wife and myself will be happy to help you down this journey. And as we call it, and as Dr. Greene rightly identified, it is not a single treatment. It is really coming up with a treatment plan and putting a lot of things together between biologics, between supplements, and then determining what will be the right course for every patient. So thank you again for attending today, and look forward to receiving a link for the patient consumer education part of it. I'll hand it over to Ramki here to close up for today.
Sounds good. Thanks, Suman. Thanks, Dr. Banerjee. And thanks, Dr. Greene, for an excellent presentation. And on the closing note, basically, tomorrow's session, we're going to have CPR at home, especially during pandemic. I know things are opening up, so we'll be winding up Weekend Wellness pretty soon. But for tomorrow's session, it's going to be Derek Walters, who's going to be presenting on CPR at home. Do join us at 4 o'clock Sunday afternoon. Thanks a lot. Thanks everyone for your time.
Thank you.
Thank you.
Thanks, Ramki.
Did you need me to push a particular button or something to turn it back over, or how do you want me to do that?